Third-degree burns. In 2003, the Station nightclub fire in Rhode Island killed 100 people. Many died instantly from smoke inhalation, but dozens suffered catastrophic burns before succumbing. Survivors described searing pain, skin melting off in sheets, and a total loss of sensory control. Third-degree burns destroy both the epidermis and dermis and often affect underlying tissues. Initially, nerves may be so damaged that pain sensation is lost. However, the surrounding second-degree burns remain intensely painful. The body reacts with systemic shock, a collapse in blood pressure, organ perfusion, and extreme inflammation. Dr. David Herndon, a burn expert at the University of Texas Medical Branch, notes that burn victims experience prolonged hypermetabolism and inflammatory response, meaning the body essentially turns on itself over time. Death, when it comes, is rarely quick. It may involve weeks of infection, multiple organ failure, and unrelenting pain that resists even high-dose opioids. Decompression sickness, the bends. On August 3, 1983, a deep-sea diving bell accident off the coast of Norway claimed the lives of 4 commercial divers. A sudden drop in pressure caused nitrogen bubbles to expand explosively within their bloodstreams. They died within seconds. One of them, Edwin Coward, was torn apart from the inside out. Decompression sickness occurs when a person ascends too quickly from high-pressure environments. Nitrogen dissolved in the blood forms bubbles, obstructing blood flow, inflaming tissues, and damaging organs. While some cases are mild, severe instances cause agonizing joint pain, paralysis, and convulsions. Neurologically, patients report extreme headaches, chest constriction, and a sensation described in medical texts as the feeling of being crushed. In fatal cases, death follows a cascade of embolisms and respiratory failure. According to a 2001 study in undersea and hyperbaric medicine, the experience is equivalent to simultaneous stroke, heart attack, and systemic inflammation, all while conscious. Rabies. In 2011, 8-year-old Precious Reynolds became the first person in California to survive rabies without vaccination, using the Milwaukee Protocol. Most others are not so lucky. Once symptoms begin, rabies is nearly always fatal, and excruciatingly so. Rabies attacks the central nervous system. Early symptoms include fever and confusion. But as the virus moves into the brain, patients develop hydrophobia, an inability to swallow water due to throat muscle spasms. The mere thought of drinking triggers choking, panic, and convulsions. In later stages, hallucinations, paralysis, and respiratory distress set in. The agony is psychological as well as physical. Consciousness remains intact through much of the progression. The World Health Organization classifies rabies as one of the most painful viral deaths due to its prolonged symptom phase and neurological assault. Without treatment, death occurs in 2 to 10 days, preceded by terror, isolation, and severe neurogenic pain that no known medication fully alleviates. Tetanus. Tetanus is caused by the bacterium Clostridium tetani, which produces a neurotoxin that blocks signals from the brain to the muscles. Before the widespread use of vaccines, tetanus claimed thousands of lives annually. The most distinctive symptom is opisthotonus, an arched, locked-back position caused by extreme muscle spasms. Patients remain fully conscious while their muscles convulse uncontrollably, often fracturing bones or dislocating joints. Respiratory muscles are also affected, making breathing painful and erratic. One historical account from the 19th century surgical wards describes tetanus as the slow crushing of the soul in a cage of flesh. Even modern ICU sedation cannot fully mask the agony. According to the CDC, in untreated cases, the pain lasts for days. Death typically results from asphyxiation or cardiac arrest triggered by relentless spasms. Pancreatitis. Unlike sudden injuries, Some of the most painful deaths unfold slowly from within. Acute pancreatitis, particularly when necrotizing, is among the most internally agonizing conditions. Steve Jobs, who died of a pancreatic neuroendocrine tumor, endured years of complications. Though not classic pancreatitis, in acute cases, digestive enzymes meant to process food begin digesting the pancreas itself. Pain is concentrated in the upper abdomen and radiates into the back. It is persistent, deep, and described in clinical literature as gnawing, burning, and stabbing. In severe episodes, patients may suffer systemic inflammatory response syndrome, SIRS, multi-organ failure, and shock. A 2015 paper in Critical Care noted that pain management in these cases often fails due to the resistance of pancreatic pain to opioids. Unlike trauma, the dying process here is prolonged. Patients remain lucid as their organs fail, experiencing days of unremitting pain before succumbing to sepsis or respiratory collapse. Radiation poisoning. In September 1987, a radiological accident in Goiânia, Brazil, exposed over 200 people to cesium-137. 4 died, including 6-year-old Leitidas Neves Ferreira, who absorbed the isotope through contact with contaminated furniture. High-dose radiation exposure destroys bone marrow, intestinal lining, and eventually the brain. The process is slow and torturous. Initial symptoms, nausea, vomiting, and skin burns, worsen into ulcers, internal bleeding, and immune collapse. Victims lose hair, their skin peels away, and internal organs hemorrhage. At high exposures, pain receptors in the gastrointestinal tract fire continuously. In the final stage, known as the gastrointestinal syndrome, patients suffer dehydration, septicemia, and neurological breakdown. The 1958 death of physicist Harry Daghlian from acute radiation syndrome is one of the earliest documented cases. He suffered for 25 days in isolation while his organs gradually shut down. His pain was described by attending physicians as continuous and only partially controllable. Cluster headaches leading to suicide. Although not always fatal, cluster headaches have been implicated in suicide, a form of death driven by unbearable pain. Often dubbed suicide headaches, they are considered one of the most painful conditions known to medicine. Pain is localized behind one eye and described by patients as akin to an ice pick stabbing the brain. Attacks last from 15 minutes to 3 hours and can recur multiple times per day. Some sufferers have taken their own lives during active cluster periods. In a 2004 study published in Neuralgia, 55% of respondents reported suicidal thoughts due to the pain, and 2% had attempted suicide. Though not directly fatal, the pain intensity, rated higher than childbirth or amputation without anesthesia, drives a small subset of sufferers to seek permanent relief. Ebola. In 2014, the West African Ebola outbreak killed over 11,000 people. The disease, caused by the Ebola virus, results in internal bleeding, organ failure, and unrelenting gastrointestinal pain. Patients experience fever, muscle aches, and vomiting, followed by hemorrhaging from eyes, mouth, and intestines. Pain results from widespread tissue necrosis and the breakdown of blood vessel walls. Unlike many diseases, Ebola causes both nociceptive tissue and neuropathic nerve pain. Morphine is often unavailable in outbreak zones, leaving patients to suffer without relief. Dr. Kent Brantley, an American doctor who contracted and survived Ebola, described the pain as total, bone-deep, relentless, and beyond description. For many who do not survive, death occurs in isolation, amidst blood loss, confusion, and unbearable suffering. Trigeminal neuralgia during terminal illness. Trigeminal neuralgia is often called the suicide disease. It is a chronic pain condition affecting the fifth cranial nerve, which carries sensation from the face to the brain. While the condition itself is not fatal, it has led to documented suicides. And in rare terminal cases where trigeminal neuralgia overlaps with cancer or degenerative disorders, it has contributed to profoundly painful deaths. In 2017, a palliative care case published in the Journal of Pain and Symptom Management detailed a patient with metastatic head and neck cancer who developed intractable trigeminal neuralgia. Despite high-dose morphine, carbamazepine, and multiple nerve blocks, the patient described the pain as electrical shocks, unrelenting and face-consuming. Each attack lasted seconds, but occurred hundreds of times per day. Swallowing, talking, or even breathing could trigger episodes. In the final weeks, the patient was unable to eat or speak, choosing palliative sedation to escape the unmanageable pain. According to the American Association of Neurological Surgeons, trigeminal neuralgia is widely considered to be the most painful condition known to medicine. When it coincides with a terminal disease, the combined burden of neurological and systemic pain results in a uniquely agonizing and emotionally devastating death.